excited to have you all here. I am joined today by Dr. Kelly Sturm with me. We are going to be talking everything that revolves around exercise and cancer care. So excited to have Kelly on. Before we get started and start throwing some questions at Kelly, I'm going to let her briefly just kind of give a background of herself, what she does, what she's practicing. So Kelly, I'm going to go ahead and drop it over to you and kind of give us a quick background.
Yeah, no, thanks for having me. And thanks, Evan. So I am a physical therapist by background. Been practicing for a little over a decade now. I am a board certified oncology clinical specialist and also a certified lymphedema therapist. So I treat anything in the cancer rehabilitation realm as well as lymphedema. I also treat a little pelvic health as well. Currently, I'm in an outpatient setting, so seeing patients in that realm. And then I also am working a lot with program building and also doing some social media and just general public awareness as well.
Wonderful, wonderful. Well, Kelly, if you're ready, we can jump right into these questions and we'll go from there. Sound great?
That's great.
Awesome. Well, the first question I have for you, Kelly, is why is prehab essential for newly diagnosed cancer patients? And to follow that up, how soon should patients start exercising and how frequent? And then what considerations are you analyzing? Sorry, I see more there. What considerations are you analyzing when constructing a prehab exercise program for your patient?
Yeah, this is great. So first, I'll just start with what is prehab? When we're talking the term prehab, that's just a general term that we use for therapy or rehab that happens before a cancer treatment. So before someone has chemotherapy, before someone has surgery, we consider that in the prehab stage. And why is this important? Well, there are some research being done. If we can get patients doing exercise, building up strength, building up cardiovascular health, that they do better, not only during cancer treatment, but also. So we know that cancer treatment comes with a lot of side effects that can linger on for months to years for some. And so anything that we can do pre or prior to those treatments, surgery, radiation, and chemo, we have found better outcomes. So they've looked at different cancer types, lung cancer, colorectal cancers, and they have found similar results. So how soon? As soon as we can. Sometimes when you're diagnosed with cancer, it turns on a dime and you're getting into treatment within a week or two. But research has shown that even having 2 or 3 weeks of exercise programming done before treatment can have significant benefits after treatment as well. So as soon as we can get someone with exercise, that's when we want to start. And when we're considering that, we just want to meet the patient where they're at. Some are really into exercising, they already have. And so we want to make a program that fits where they're at. Some are brand new to exercise. So we want to start nice and slow, nice and light, but anything that we can do to give them an exercise program that gives them a little bit of a challenge, that's not just an easy, light walk in the park, but that gets them moving, gets their heart rate up. That's what we want to focus on.
Perfect. I love how you talked about meeting the patients where they're at. And that does bring up the whole idea of like that individualized care. And I know that we have some questions that are going to dive into that a little deeper later on, but to kind of piggyback off that question and go a little deeper, we talked about, how soon and how frequent, but with that, are there any specific guidelines or recommendations for things like intensity, duration, frequency of exercise for these patients that are dealing with, increased levels of fatigue?
Yeah, so they're all over the board. They've done research studies that are all over, but generally the goal is to have intensity like we would doing 65 to 80% of someone's max heart rate when they're doing cardiovascular exercise is a great goal. Duration, we try to hit 150 minutes a week of moderate to intense exercise. Sounds like a very similar thing that we do for the general population. And frequency, we try to get, again, the time period, or thinking 3 to 5 times a week of 30 minutes of cardio. And then we always try to do some strength. So we try to hit 2 days a week of some full body strength exercise. And it'll range person to person, but that's the goal. So 150 minutes a week of cardio and about 2 days a week of strength training.
Wonderful. And when we look at, I guess, that 115 minutes a week in cardio and then more so in the strength training, how much are you kind of taking into effect, I guess, spreading that out over the week? Are you kind of like looking at individualizing it? I know some days patients are going to have good days, some days are going to have bad days, but, generally what kind of is your approach there?
Yeah, that's a really good question, because again, we have to meet the patient where they're at. We talked about the side effect fatigue, and that's the number one side effect we see with cancer treatment. I think the says about 90% have it. I would say in my practice, 100% get some sort of fatigue. And so they're going to have good days and bad. So we adjust, we meet them where they're at. So I always like to use the phrase most days a week. So whether that means 4 days a week or 5 days a week, that we split that up. We also want to consider if someone's in treatment or having a lot of fatigue, the longer periods of time, saying an hour at once, might be just too much for that person because it's going to, add into their fatigue too much. So we just try to scale it down, maybe doing 30 minutes or even doing 15 or 20 minutes once in the morning, once in the evening, split it up. We want to make sure that we're not adding to the fatigue, but we do know with research that doing some sort of cardiovascular exercise can actually help lower fatigue in the long run. So again, meeting the patient where they're at, seeing how they are day to day, and scaling up or down based on how they're already feeling.
That's great. And we talked about, you talked about so many great things. You talked about like the duration, the frequency, how soon to start, that individualized care, looking at how much they can tolerate day to day. And so now I want to kind of flip the switch and jump more into like, the actual exercise activities. So are there particular exercises or modalities for that matter that are most suitable or effective for managing cancer-related fatigue? And how do you customize those for individual patients?
Yeah, so that's the big one. In the cancer rehab world, we're pretty excited about this because research has looked at exercise as an intervention, medication as an intervention, and then also psychosocial help as well. And they've looked at what actually helps cancer-related fatigue. And the number one thing shown over and over and over again in the research is that cardiovascular exercise is the best way to combat cancer-related fatigue, a lot better than medication would. So we are trying to always advocate how important exercise is, even if it's something gentle and light, something to get someone moving. And so some people, our goal is to do something like high intensity interval training or HIIT training, trying to get a higher intensity for short periods of time, something that they can tolerate to help move the needle. While others, something might be intense for them is something like walking or going for a light bike ride or something simple like that, something that gets their heart rate up even just a little bit that can help move the needle towards the goal of addressing their cancer fatigue.
No, I love that. And I know that's a loaded question. When you start getting into those practical exercise tools, it's a lot to cover. And I know we have a very, we're on a time schedule here as far as what questions that were coming in and what we want to get to. So I do want to say, I know that we do have the Oncology Rehab Summit coming up on February 15th, which you're going to be participating in. You're going to be talking about this all more in great detail. So I know that you're probably going to bring in a lot more of these exercise interventions and practical tools that clinicians can share. But along with that, can you share any insights you have on adapting exercise programs for patients with different types of cancer and considering, potential impacts on their individual energy levels?
Absolutely. So different types of cancer. I like to still look at each person for where they're at. And each person's treatment's going to be different, even within the same type of cancer. Once you've been in cancer rehab, you tend to see the similar treatment options for breast cancer versus colorectal cancer versus pancreatic cancer. So you kind of know what they likely are going to have for treatment and what to expect. But still, we want to meet the person where they're at because they're all going to vary so much within cancer type. We know that some of the treatments like pancreatic cancer, liver cancer, colorectal cancers, they might get more intensive chemotherapies, which tend to have more side effects. And so we will want to really, and I should say, it will also change their blood counts quite a bit. So we know that we have precautions to watch for, safety things to watch for, and they also might have more side effects. So we're going to be adapting person to person, watching their blood counts, communicating with their oncology team, and then scaling their program to, again, find something that is meeting them where they're at, but not overdoing it as well. While someone who maybe just is having a surgery or just having radiation, they might be able to do a little bit more. And so we're adapting more based on the patient's side effects and also their current medical situation more than we are adjusting for type of cancer.
And well, that takes me kind of into my next piece, which is, I think where we're talking about here, sometimes you're looking at, multiple specialties of cancer, whether it's pancreatic, whether it's breast, and we're probably looking at isolated incidences through treatment, but now like kind of over the spectrum, over long-term care, how do you monitor and adjust exercise programs over kind of more of that continuum of care? Especially as they progress through these different stages of treatment and recovery. I know it can kind of, wane and weave through, times where they're feeling good, times where they're feeling bad, as you already mentioned. So how do you kind of respond to, both regression and progression in treatments?
Absolutely. So surgery is usually pretty straightforward because it's usually a post-surgery, pre-surgery, and they're moving along. When it comes to chemotherapy, is probably the most well-known to really fluctuate with someone's side effects. And so there's a term called chemotherapy periodization, where let's just say on average, someone's getting chemotherapy once every 3 weeks. It varies, but that's a general cycle, we call it, for chemo. And so we know that first week of chemo that they're going to have a lot more side effects. They are going to feel a lot more run down. They might have more nausea issues versus week 2, week 3, when they're off of chemo, they might have more energy. And so with the exercise program, we will adjust based on their cycle. So that 1 week they're getting chemo, we might scale it back. Again, give them a little bit more break, do lighter exercise, where in week 2, week 3, when they're off and feeling better, we might then challenge them a little bit more to make up for it or take advantage of the time when they're not having as many side effects. So that's how we adjust and monitor. We're also watching blood levels each week to make sure there's any safety issues. And that's really during treatment. And then after, when someone's off treatment, then we can get back into more of a scaled approach where we just meet the person where they're at and try to gradually increase their activity level and their exercise.
It's wonderful. And now I kind of, we talked about this continuum of care. But I think in the reality is, and bigger picture is understanding that, while we always want progression as clinicians, regression is the other side of that. And we don't always, that's not something that's always our outcomes or goals, but we have to understand that plays into care. And so that's kind of where we're going to shift here and go more into the palliative care patients and understanding, what are goals, of exercise during that stage of patient care? How are we advocating for exercise with other members of the care team, that are probably promoting, rest, minimal out of bed activities, things of that nature, and more comfort care? How do you kind of I don't want to say impose yourself, on other members of the care team, but kind of advocate for what you want to be able to do for that patient in that specific stage of recovery or stage of, their cancer care?
Absolutely. It's always an ongoing thing to try to advocate for our patients because they do, they are told to rest and care. But we've known with really the last decade plus of literature and research to show that exercise and movement actually is going to be one of the best things for them. When it comes specific to kind of the hospice area and long-term metastatic or stage 4 disease, the goal is not to get rid of the cancer. The goal is to elongate life. Our goals shift often to maximize someone's function, maximize someone's quality of life. And so our number one goal is typically to learn what the patient's goal is. What does that look like for them? Are they trying to stay active? Are they trying to still work? What are those functions that their goals are related to? And we'll adjust the program more for that. We know that some sort of exercise and movement is always going to be helpful. And so we want to include that. But then we also add in, is it strengthening for certain parts of the body because they want to do a certain activity? And so we'll individualize it for that population. If we go back into those who are in the middle of treatment with the goal of it being curative, then we really still want to meet them where they're at the time and then gradually increase their exercise, maybe 10% or so at a time, communicate constantly with their oncology team because we need to for safety and for medical reasons. But they continue to have benefits. And I think we've made some really good strides as far as a cancer rehab community, showing how important this is to the overall medical team.
And we did have a comment come in here where someone was, saying, God bless you for, the level of attention and care that you provide for these patients. So thank you for that kind comment. It's always great when you get to speak, especially for me, in the position I sit in, to be able to speak to amazing clinicians that are doing really, really outstanding work in the field and really helping, patients that need this level of care. And so I do have a last question for you, and it's a little bit of a curveball question, but it's more so, I guess, from my personal experiences. So I know we've chatted about this before, but in a previous life, I was a physical therapist assistant that worked in acute care. So I don't get to do that anymore. I live more in this seat. But when I was doing that, I mainly worked in orthopedics, but I remember one day they called me up. They're like, "Hey, we don't have coverage on, the oncology tower. We need you to go see a patient over there." The nervousness that was inside of me, it's just one of those things because you don't interact with that patient population as much. You go in, and I remember going in, and the patient was just very, frail. The deconditioned side of it, probably a little less motivated to want to get up for therapy, and it's completely understandable. And I just remember feeling inside like, what do I do? First off, and how am I going to make this, this sweet little person get up and do this when you can tell they're just, they're struggling. And so I imagine that there's a lot of clinicians, and maybe even for you when you started off, that have these similar feelings. But I guess where I'm going here is, for anybody that maybe isn't, specialized in oncology care, but wants to learn more, get their, dip their toes in the water, or start to understand how to care for this patient population, where would you kind of, push those individuals to start to grow that comfort level and those clinical skills?
Yeah, it's a really good question, and something we talk a lot about in our cancer rehab community per se is, there are over 18 million cancer survivors in the United States alone, let alone the rest of the world. And it's not a matter of if someone in the rehab world will see someone who has or who has had cancer. It's a matter of when. There's no way you can go through a whole career in any area and avoid that completely. And so it's a matter of, knowing the red flags. Of course, there are some red flags to watch out for, some safety things to be considering, like someone who may have bone mets. You want to consider fracture risk for something like manual therapies. But at the end of the day, you know how to treat this population because you know how to treat their impairments. If someone has weakness, if someone has debility, if someone has any issues getting in and out of bed, or who has tightness, loss of range of motion, as a rehab professional, you know this, it's just in a different format. So if you can apply the same things, just understand some of the safety things. I think we've been, hear cancer and we hear it as a red flag. So we get scared as a rehab professional, but you are capable of treating this population and they really could benefit from them. As long as you're considering safety, you can move forward with interventions as you generally would, and you can always learn more online. There's a lot of courses coming out about cancer rehab, and you can go more in depth there. But a lot of the skills that you've learned in PT school and OT school and what other school you can apply.
No, it's wonderful. I would say you knocked my curveball out of the park there. I do want to say, because I know you talked about, resources to learn more. I know, and I'll let you share. So you do have your own platform where you do a lot of this, education on different social media platforms. So I'll let you share what that is to our audience, for individuals that maybe want to connect with you more, learn more about the programs that you offer and the education that you do.
Yeah, absolutely. No, thank you. So I have a website, cancerrehabpt.com. And I'm also on Instagram as well as on YouTube under the same thing, Cancer Rehab PT. And I started with patient education, just bringing out knowledge, and that's grown into provider education as well, just trying to get awareness out of how to treat cancer rehab, what are the side effects, and what are the interventions that we do to address the side effects that come with cancer and cancer treatment.
Wonderful, Kelly. And the last thing I do want to say, for anybody that's currently watching who wants to learn more, wants to hear Kelly obviously speak more in volume to this specific topic, and those that might be just joining us, we do have the Oncology Rehab Summit coming up. That's going to be a live virtual event on February 15th. We're going to be joined by Kelly on that event. She'll be speaking more to this topic, along with some other amazing speakers in the field that'll be touching on different things like lymphedema health, nutrition, etc. So thank you, Kelly, again, for joining me today on this stream. It's been a pleasure speaking with you and having you answer some of these questions.